Hi, my name is Dr. Cirecie West-Olatunji, and I am Professor and Director of the Center for Traumatic Stress Research at Xavier University of Louisiana. Today, I'm continuing this series of 10 interventions with young children, particularly those who've experienced trauma. Today, we're going to talk about storytelling. So storytelling is both telling children stories, but also hearing children tell stories to you. What do you need? Well, you could start with a book. That's always good. So you need to locate a book that might be worthy and developmentally appropriate and relevant to the issue. But also you can use your imagination. So you need to think about what are the issues that are challenging, what have been brought in by the client, the presenting problem, and think about what story might assist them in being able to talk about some of their feelings, to be able to express a narrative. So you want to think about what might serve those purposes. So if it's a parent-child session, then you want the child to hear a story that a parent is telling them. So this is a great opportunity for you to assist in their bonding. You can assist the parent in actually providing an intervention that they could use at home and continue to work with the child. You can assist the parent in locating an appropriate book. Sometimes I purchase books and I give those to parents so that they can do that. I also can direct parents, give them a list of books that might be appropriate, and for them to go to the local bookstore to purchase those books. The other way is that if you're in session and you want to read to the child, again, select an appropriate book that you want to read to the child, or you can ask the child to tell you an extemporaneous story about a time when. So again, it's open-ended. The child really is just telling you whatever comes to mind, but you do provide the guideline because you do want it to relate to the presenting problem. Now, in providing this opportunity to do storytelling, it can be very restorative because children can tell a story and then you can ask them to tell it a little bit differently where there's a different ending to that particular story. Another is that if a child is stuck and they have particular feelings and they can't get past that, we certainly can read a story where there's resolution to those particular feelings. Also, it helps children with their creativity and their expression. They can really develop their skills by asking them to tell stories so they can get better at that, better at being able to express themselves and to think creatively and use their imagination about how the world operates and their personal power and agency in what things are happening for them. It also allows us to facilitate the telling of the story. So we know it's very important. We often have children who experience traumatic events who will relive it, but they'll relive it in very disruptive kinds of ways. And so what we want to do is to bring that out in a very intentional way. We want them to be very conscious of what's happened to them, and we want them to be able to fully express themselves and tell their story. Okay. So benefits. One is that, again, like many of the other interventions that I've presented, it's very child-centered and it's also very culturally centered. So once again, we are relying on the child, we're relying on the parent or caregiver to be able to tell stories. Sometimes the stories that they tell are family stories. There are things that have been passed on from generation to generation, and so that's very instructive for children because it promotes their family values. It's non-directive. Again, we're not telling a child, we're not providing a lot of structure for it. It's very open-ended to allow us to assess what's happening. It allows the child to tell their story in their own terms. Again, they use their own words that they use within their family system and within their own cultural system. And again, it's both instructive because it helps children to have appropriate or healthy responses to circumstances, and therefore it is restorative. Now, some of the challenges to this is that sometimes you have parents or caregivers who do not have very strong reading skills. So they might have broader literacy skills, like I said, of telling stories, that's literacy, but their actual reading skills may not be very good at all. Sometimes because I will direct them to purchase a book from a local bookstore, they may not have the funds to be able to purchase a book, and they may feel anxious about that, not tell you, so they might look like they're not complying when in fact there are other reasons for their anxiety. A lot of times even libraries are not accessible to people in certain low-income communities, and so it may be difficult for them to get to reading materials. So you need to find ways to work around that so that you use some of your social justice skills to help them to get access to the resources. For us, if we haven't worked a lot with young children, we may not be as adept in selecting reading materials that are developmentally appropriate. So a lot of the reading materials may be for school-age children, so you may need to reach out to an early childhood provider and ask them what might be an appropriate book. So based on the things that I've talked about, I would say that on a scale of 1 to 3, where 1 is beginner, 3 is an expert, this would be a level 2. I would say that this is better used by someone who's already licensed, independently licensed, but maybe early in their career, all the way through a very experienced therapist. Often you ask me what cases might be more appropriate for this intervention, so I'll offer you a case from my own experiences. This is the case of a 4-year-old Puerto Rican female who was brought in by her biological mother after the death of the maternal grandmother. The child experiences signs of unresolved grief as difficulty sleeping at night, and was often tearful and fretful and irritated throughout the day. So with this, I was able to purchase a book. This one that I have here has poems by Eloise Greenfield. Eloise Greenfield is very good at poems that can be read to children. I have one here. I'm going to take the time to read one to you. All of her poems are very, very short, so they're very easy to read. This one is called The Man in Red. Whenever he puts on his red jacket, red tie, and his serious face to match the neighbors, know that he's going someplace special. And here's a picture of the man in red. So this is a great opportunity to talk to a child about wearing special clothes, to go to special events, about how important it is to think about where you're going and how you're going to feel when you're there, and to ask them, do they have a special outfit that they like, and be able to talk to them about that. So now that you understand how this works, I recommend that you record a story, your own story, about a critical event or period in your life during your early childhood years. So why don't you try that? And as always, I would love to hear how it worked for you. Please email me, telephone me, go on our website. We have more resources for you. And of course, hit us up on Twitter or Instagram at XULA_CTSR. I want to thank the New York University Bob's Library Digital Studio and the staff at the Faculty Resource Network. Thank you, and I'll see you again later.